Thank you, Mr. Chairman, and I'm going to follow right along that same line because I think what you're laying out is basic common sense when it comes to the integration of these two systems. My question is why is it that when we have what is considered to be excellent care with the military system, the MHS involved, and then we have to transition these young men and women as they leave the armed services into a VA facility in which we start all over again? We have different ways of communicating, and in fact, let me just ask this. In your experiences, how well do we integrate the transfer of information from the MHS back into the VA systems today?
Senator, I can take a crack at that. I believe you're spot on. My experience in transitioning from the DoD to the VA was more of a lukewarm handoff than a warm handoff. I had to sort of navigate my way to the VA. I now have closed that gap, and I get my care there, as I mentioned. But it's not a smooth process. So why is it still the case that the two healthcare delivery systems are so partitioned? I think you have to go back to ancient history almost in our country. And if you look at Secretary Gates' comments about his experience as Secretary of Defense, he said the one department that gave me the most fits was the Department of the VA. So there are historic challenges. The VA wants to do it their way. Understandably, most of us do want to do it our way, but I think there are clear opportunities and a clear demand signal to break down those barriers and realize opportunities for synergy. So I hope we can do that.
I think the focus should be on whether or not we're delivering for the veteran and not necessarily the survivability of the VA itself. And I think that sometimes gets mixed up.
Yes,
I'm just curious, gentlemen, we've talked about trauma centers, we've talked about the integration or an integrated healthcare system and so forth. We're not right now in we're not at the same degree of activity and intensity with regard to battlefield casualties as we were just a few years ago, and therefore the opportunity for these surgeons, these battlefield surgeons and others to actually learn right now is probably not as great. How do we keep the intensity or the capabilities, the training, how do we keep that up to date when we don't have those opportunities? And I'm not going to say that they're good opportunities. I'm glad that we're not in them, but how do you allow that surgeon to keep those skills up to speed when you don't have the types of casualties that you have on a battlefield that we were experiencing for a number of years?
Take care of sick patients, sir. There's an analog between taking care of a patient who has bladder cancer and needs to have their bladder removed and taking care of a patient who's just had a gunshot wound to the abdomen, needs to have their bladder reconstructed. We need our military medics taking care of sick patients. They do that at hospitals that are well-staffed and well-resourced to take care of sick patients. And so, that's what we have done historically to maintain the proficiency of surgeons or of critical care nurses or of medical logistics staff, is keep them busy during peacetime taking care of sick patients. It's not a perfect analog, but that is the best surrogate, and that requires resourcing the system, making sure that sick patients can get in the door and get the care they need. And to your point about the VA, I would just say I applaud the VA for accelerating moving forward with their electronic health record, because that is going to be the secret sauce that enables greater sharing between the two departments and will enable us to track patients from the day they join the military to the day they take their last breath and really learn how to improve both systems.
Is the current system that you use integratable with the VA's new proposed medical records healthcare system?
So I am not an expert on the VA system. When I left the movie, they were looking at purchasing the same system that the DoD had purchased. I hope that those with oversight responsibilities will insist that the two systems are integratable, because technologically, there's nothing to prevent that. I mean, civilian healthcare systems integrate Epic and Cerner all the time, or McKesson and Epic. There should be no technological reason why we can't do that.
Thank you. General Robb, anything to add to that?
I would share what Dr. Friedrichs said, in fact, what I was excited about is I've had the opportunity for family members to be in civilian hospitals, and they are able to reach into it and see Genesis now. And so they know the health care that my family members have been getting in the military. I know that has absolutely been the vision between the Department of Defense and the Department of VA, and I believe that is still what I would call the true north. Thank you.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator Rounds.